What are some of the promising clinical and community programs that address this issue?
Clinically, we can modify a very popular form of therapy that we have now called cognitive behavioral therapy to conceptualize and address internalized oppression. For instance, I talk about in the book how, you can or we can conceptualize internalized oppression really as a set of self-defeating thoughts, self-defeating emotions and behaviors that have been developed over time as one experienced an oppressive environment. So people who, grew up receiving messages, negative and inferiorizing messages about their heritage or about their social group, eventually they might internalize that, and then that will create really a cognitive system within them that is self-defeating and that is not adaptive. And that can lead then to many problems like low self-esteem and depression and other related concerns like substance use and abuse and high-risk behaviors and whatnot. So we can use, in this case, cognitive behavioral therapy and modify it to conceptualize and address internalized oppression, just like how we address other forms of psychopathology. Now, there are also community efforts that tries to address internalized oppression. They don't look at internalized oppression, though, as a psychopathology in the clinical sense or in the medical sense. They see internalized oppression more like a social ill. And so, so they can still address internalized oppression in the community without having to think of it like in the clinical sense or in the medical sense and so forth. And all these, and efforts in the community really focus on bringing awareness about internalized oppression and why it's problematic, but also the way they address it is they try to really bring pride or increase people's pride about who they are, about their heritage, and about their social group. So those are the efforts in general. That's what they look like.